One of the things that I have learned to do is to really focus on preventative care screenings and routine checkups. I know that at the end of the day, no matter what I do, God has the final say. But at the same time, I believe it is my responsibility to do the best that I can to take care of my body. And even though I do a lot of things externally and try to consume the right foods internally, I know that with proper screenings, whether that's blood work, whether it's a physical every year, whether it's getting an eye exam, is something that I can do that can enhance and improve my overall well-being. And in today's video, I want to share with you some routine checkups that you can do in 2024. It's not too late, that can help you also do some things that can improve your health. I want to share this stat with you that I found. According to the NIH, that is the National Institute of Health, in a June 2020 published article, it stated that only 8% of Americans undergo routine preventative screenings, and on a national level, very few states, 15 out of 50, have above average care metrics. Also, this article shared that the U.S. squanders over $750 billion in healthcare. Now, for the Gen X woman, I want to say this. I think it's imperative, and I think it's a form of stewardship for you to take care of yourself. It is really giving honor and glory to God by you doing these things, even though a lot of times we don't want to do them. It is not something that is fancy. It's not something that you necessarily enjoy, but I just think as being a good steward over my body, I need to make sure that I'm okay. And doctors are great in the sense that there are some doctors who really and truly want to do well, and they really took that oath that they took in medical school very seriously. They don't want to do any harm. But obviously we know we have predators out here. So the better information that you are armed with, it can then give you some insight, or it can give you some biofeedback or some things that you can do externally to really improve your overall well-being. And so today it is my goal to share with you just a few different preventative care routine checkups. I'm using those two words interchangeably, but preventative care routine checkups. And the reason I'm doing that is because some people may have insurance, medical insurance, that's listening to this video, and you have what they call preventative care screenings. And I'm going to share with you what those are and how you can identify that with your insurance company. And then some of you may pay for that out of pocket. I encourage you to invest in your health and maybe save some money so you can pay for these screenings out of pocket. Don't buy the coffee, or don't go buy the Gucci, or don't go buy the Hermes or something like that. You are worth taking that time to improve your overall health. And unfortunately, there are some things that we can't do. Even if you go to a private lab to have blood drawn, you have to have someone else to actually process that information and give you the result. Okay, so we can't despise what the healthcare system offers, but we need to understand that the healthcare system no longer is a system to help you stay healthy. It is very reactive to usually when people are in a crisis. This is when the healthcare system kind of kicks in. So I want to share with you some things that you can do to be proactive and not reactive. Talking about the stat that I gave you, the $750 billion that is squandered by the healthcare system, I want to talk about your medical insurance. Now, maybe some of you may not have medical insurance and some of you do, but most insurance plans have a preventative care screening list of exams and screenings that you can have that is paid. There is no out-of-pocket cost to you, and I'm going to share a few of those with you. And I want to also give you some insight of where you can get this information. If you have an insurance card, unfortunately, they don't send this information to you. I don't know why some insurance companies seems like it's top secret. Mine does not. So even with my insurance card, I turn it over, you call the 1-800 number. Usually you're gonna have to call another company outside of that one to either get this particular packet or this information I'm gonna share with you. because I don't know why, because there's one part of the insurance company, at least mine, one part of the insurance company take care of the benefits, or if there's a filed claim, but then there's one part of the insurance company that has information for you as the patient. And so do what you can to try to find this information. But usually things like this is your preventative care screening with your dentist is one. Your preventative care screening with your gynecologist for women, that is one. And what that typically includes is like a pap smear. And I won't assume that everybody knows what a pap smear is, or sometimes it is referred to as a pelvic exam. When a woman has a pap smear, basically what the doctor is looking for is for cancerous cells, abnormal cells during that pap smear, that pelvic exam. So if you need additional testing that may not be covered in your preventative care, but this is what pap smears is for. It's looking for precancerous or abnormal cells, and so that's what it's for. That's what it's checking for. So if it's STDs or something like that, it may cause an abnormal pap smear, but that's not the purpose of the pap smear. I hope that makes sense. Another one is colonoscopies. If you have reached a certain age, you need to get a colonoscopy. Another one is, especially if you have a family history of cancer, this is important. The gynecological exam, the pap smear is important if you have a history of cancer. And just for being a woman, there's just certain things that women have to go through just for the mere fact of being a woman. Number two, if you have a family history of cancer, I would encourage you and really implore you not to prolong that. I know that many healthcare insurance realms have age limits when you can start getting those exams at 50, 45. But if you have a family history of that, you can let your doctor know, and then you have some pre-existing reasons for you to start having those exams prematurely. Also, we said the colonoscopy. We talked about the pap smear, the gynecological exam. Also, the mammograms. If you have a family history of breast cancer, or cancer as a whole in your family, especially in your immediate family, your first line generation, you need to possibly talk to your medical practitioner about you being screened early if you have not reached that age. And so these are things that you can look into for yourself. You know, I can't tell you everything that you need to do. You have to be your own healthcare. This is why I talk about personal health literacy so much. It's because you have to be your own advocate. You have to take control of your own life. So all of us will have specific situations and circumstances that are personal to us. And so what I'm doing, you may not need to do. And maybe you may not feel like it's something that you need right now, but I really just would implore each woman who listens to this video to really just assess. Look at your family history, look where you are now, and just assess that information. So the next routine exam I want to share with you is an eye exam. Most insurance, I won't say most, I really don't know what most insurances do, but I would say mine pays for a eye exam. Now, in all of these exams, whatever therapeutic partner you choose to use, I would encourage you to use a specialist. So what am I saying? I know that there are some women who go to their general practitioner and they allow the general practitioner to also do the pelvic exam or their pap smear. I would not recommend that. I think you would say the same, that that's a special area and you would want a specialist. A general practitioner is someone who has an overall knowledge about different topics, but you want someone who specifically knows and how to identify if there's a problem for that specific area of your body. You want to go to a colon and rectal specialist for the colonoscopy, okay? You want to go to, you may not be able to get into an oncologist, or I'm not sure, unless you had some type of pre-existing precancerous some type of situation for the mammogram, but you want someone to be able to review that data that is received from that mammogram to be able to identify if something is wrong. You're not going to have these exams to play around, because for women, a lot of this stuff is very, very invasive, so it's not like you're going because you want to have fun. You're going because you want to make sure that you're okay. So I believe in getting the best of what I can afford. And do your research, look at your area, be willing to travel to even go see doctors if your insurance allows or you have the financial resources to do it. I feel like I'm worth that, so I'm willing to do those things. Okay, and so the next routine exam I want to share with you is an eye exam. Explain to you the difference between an ophthalmologist and an optometrist. To put things into perspective, an optometrist, let's associate them with lens crafters. These are going to be the people, when you walk into their office, they're typically going to have a bunch of glasses and frames that's on display, because typically that's where their money is being generated. It's just like a gym. Most commercial gyms, the bulk of their money is made on the fitness classes and things of that nature, or the personal training. That's where they make their money. But in terms of a optometrist versus an ophthalmologist, these places typically they have 1 or 2 doctors on site. They're optometrists, and they usually are really big on selling frames. They're really big on selling the designs of glasses, a lot of variety for people to choose from. But I'm going to share with you directly from my ophthalmologist's website what the difference is between the two. All right, he says, ophthalmologists are the most highly trained and revered practitioners in the field of eye care. The difference between an ophthalmologist and an optometrist is commonly not understood. Optometrists are healthcare professionals who provide routine vision care such as eye exams, sight testing, and prescribing and dispensing corrective lenses. Rather than going to medical school, optometrists complete a postgraduate degree program to earn their Doctor of Optometry. In stark contrast, ophthalmologists are fully licensed medical doctors who have had at least 8 years of medical training. Following medical school, ophthalmologists undergo a 4-year residency, giving them the skill to diagnose eye diseases and to prevent them in the first place. In addition, they can perform complex surgeries on the eye to repair a host of non-optimum concerns. That is the difference. Okay, choose wisely. I would encourage you to go to an ophthalmologist. I want to go to someone who can actually diagnose, give me a prognosis, and let's go forward with treatment if that's what it needs to be. Not for me to go to you and you send me to somebody else and you send me to somebody else. You don't need that. And when it comes down to your eyes, you want to have someone who is knowledgeable. Okay? All right, we talked about the dental checkup. This is something that I think people really miss out on. My insurance specifically pays for 2 preventative care treatments per year. That's what people call is your cleanings. I think this is something that's very underrated. Your personal hygiene when it comes down to your mouth, your breath, your teeth, you need to take it seriously. A lot of people are losing their teeth prematurely, and I know we're in the phase of getting the veneers and all this other kind of stuff. If you can keep your teeth, keep them. And if you can maintain them, because if you have poor hygiene now with your own teeth, you're gonna have the same poor hygiene habits now with veneers and things of that nature. And now what you're gonna do is spend so much money because you're not taking care of your overall gums, you're not flossing, you're not brushing, and things of that nature. So go to a dentist, whether that's a general dentist or a general dentist who is also a cosmetic dentist. My dentist is a general dentist, but he also specializes as a cosmetic dentist as well. So you can run the gamut. And again, you want the best. One thing I can tell you, if you walk into a dentist office or anyone who is dealing with teeth, whether it's an orthodontics or a dentist or cosmetic, and their teeth don't look good, run. Don't stay and don't let them be the one that treats you, okay? I wanna say this to you. If you go to any doctor and they make you feel like you're less than a human being, you have inherent dignity, do not go back to them again. If you have any doctor who would not listen to your concerns, now you have to be mature, and a mature adult when conversating with other adults. You don't waste people's time. But if someone makes you feel like what you have to say is not important, find another practitioner. They're all over the world. You have to choose. You have to choose and be cognizant of who you partner with, because you only have one life, and you are worth someone sitting down and just listening to you, okay? Make sure you take the time to find someone who will listen to your concerns. If you have a concern about your health, don't stop until you find someone who will listen. Last thing I want to share with you is this. When you have your labs done, where if you have routine labs done, where they're taking your blood and different types of things, I want you to make sure that you actually get a copy of your labs. You actually keep a record so you can see how you're progressing over time. And so you get this information and you keep it and you review it. Because oftentimes when you have blood work taken, doctors just look at the result, and if it says high or low, that's the only thing that they respond to. But you can have suboptimum numbers. And so you need to pay attention how your numbers are tracking over time. And don't just rely on the doctor to tell you that you're okay. Go back and look at what 6 months ago was like, in the next 6 months, in the next 6 months. Keep that. I keep a copy of my labs every time. I keep them. And when I'm talking to the doctor, I have them in front of me. You can request a copy of your paperwork. That's your personal information. So I just want you to take time for yourself. Let's be proactive. Let's not be reactive. Let's be good stewards over these bodies that God has given us. And let's make sure that we align with people who respect us, honor us, and who's going to give us the best that we deserve. I hope that this video blesses you. I look forward to seeing you in the next video. And make sure you take a look at this video that I did here about personal health literacy. And I hope it gives you a better understanding on how to deal with the healthcare system. Take care, everybody. Be blessed.